talk about why we don't have universal health care in the US. It is not an accident. So after World War II, most wealthy nations, like UK, Canada, France, Germany, built universal healthcare systems. Although the specific methodologies and the timing and all that varied by country, it was driven by post-war reconstruction, the desire for greater social equality, and fears of social unrest, which I think we need to bring back. Many governments just moved to provide this comprehensive medical care for their citizens. And here in the US, they took a different route. They tied healthcare to employment through private insurance. Why? Lobbying and fear-mongering. So in the late 1940s, President Truman proposed national health insurance, but the American Medical Association, the AMA, launched one of the biggest smear campaigns in history, calling it socialized medicine and equating it to communism, which people fell for. And this narrative has stuck around for decades. Government healthcare equals loss of freedom. This isn't just about money or politics either. Racism has shaped this entire debate because in the 1940s and 50s, Jim Crow laws legally segregated hospitals and clinics across the South. Black patients were denied care, forced into overcrowded colored wards, or just refused treatment entirely. And Southern politicians knew that a national healthcare system would force desegregation, and they needed to avoid that at all costs. So Southern Dixiecrats in Congress joined forces with the AMA to block every single attempt at universal healthcare, framing it as a states' rights issue. Does this sound familiar? And they feared federal control meant that they'd lose the power to keep hospitals segregated. When Medicare and Medicaid were finally introduced in the 1960s under Lyndon B. Johnson, the federal government had to threaten the hospitals. You either integrate or you lose funding.
They do not want to see Black people in America, marginalized communities in America, be healthy. I normally go to one Walmart in my city. I normally visit one Walmart if I'm ever going to go to Walmart. And they have a section in the Walmart that I normally go to that's like health foods. It's in the chip aisle. It has like the roasted chickpea snacks. It has the gluten-free snacks. It's also where you're gonna find like the lesser evil popcorn and the chickpea little like cheese puffs. It's all the healthy food. And I normally shop there because I like those snacks. I normally go in my Walmart and I normally just go straight to that aisle and I'm able to find it. So yesterday I went to a Walmart that was in a different part of town, and most of the people that went to that Walmart were Black people, brown people, Mexicans, Hispanics, all of that. And just simply because of the area that it was in. And I go to the same section, same aisle, same everything, and I look for the snacks and I cannot find them for the life of me. I cannot find them. I don't see them anywhere. This is a direct testament of how lower income communities are forgotten when we are selling healthier alternatives to the junk that is sold and processed and sold to us in America. It was absolutely disgusting when I made the correlation to what area we were in and the inability to access healthy snacks. Lower income communities, communities that are struggling, communities that have so much trauma in them from the country that we live in that has traumatized them for centuries, deserve access to healthy food the most. Deserve access to healthier alternatives the most, especially at places like Walmart, where a lot of people shop because of the lower prices, especially at places like that. And I have seen that certain healthy foods are not sold at places like Winco and Walmart, which absolutely disgusts me because that is where lower income people shop. And so the fact that it is not made accessible in those places and it is not made readily accessible is absolutely disgusting and needs to be talked about more.
Before I get into the meat and potatoes of this video, nothing that I'm saying in this video is a judgment or an opinion on the inherent abilities of any doctor based on where they're from. It's just an analysis of the healthcare system and factors that I think affect the healthcare system. So we have this thing called the Healthcare Access and Quality Evaluation done by Lancet, which is a study or publication that looks at medical and scientific stuff. And what HAQ does is it, quote, evaluates how effectively health systems in different countries prevent death from conditions that should be treatable. That's the key, that should be treatable with proper medical care. And it ranks all the countries in how well they, treat these conditions that should be treatable. So India, out of all countries, ranks horribly on the HAQ index. They are 145 out of 195. Really bad. However, if you look at international medical graduates, so doctors in the US who come from foreign countries, India makes up the largest share of those doctors in the US. 23% of all IMGs, or international medical graduates, come from India, which again ranks 145 out of 195 on HAQ. And so you look at this and you ask yourself whether that has any effect on healthcare in the United States. And I'm not saying it does. I'm not saying it doesn't. All I'm saying is when doctors come here from any foreign country, they have to take the USMLE, United States Medical Licensing Exam, but they've already gone through essentially medical school. So if they pass that exam, right, which is like, I mean, it's like a written exam and whatever, they're doctors, right? They're doctors. They're then practicing immediately in the United States of America. They've undergone zero education in America, zero education in the American healthcare system, yet they're then practicing medicine as physicians in America. And I think you have to consider, or at least look at the fact that, and again, this doesn't have anything to do with anyone's inherent abilities, but if you're practicing in a country who's ranked 145 out of 195 in terms of healthcare, you could be the best doctor in the whole world, but you come over here and then all of a sudden you're a doctor in this system. I mean, I'm curious what the healthcare providers think of this. I'm sure I'll catch flack for this. It's literally only meant to be a statistical analysis of the factors that are at play in the global economy.
All right, so the Trump administration has officially cut pediatric brain cancer research. So the White House decided in its infinite wisdom that we should make budget cuts to hurt the most vulnerable in this country, which are children with cancer. And rather than investing in cutting-edge research like mRNA research and like stem cell research and like all of this other type of cutting-edge funding in which scientists from all across the world, the best and brightest, come here to study, the Trump administration has officially cut that funding. But here's who retains funding. The oil companies retain their subsidies. We are paying farmers in this country not to produce food. We have major subsidies going to those farmers hit by Trump's tariffs. We have billionaires getting funding for their companies like Palantir getting billions of dollars to build the database. We have contractors getting millions of dollars, such as building Alligator Alcatraz cost about $250 million and now is broke. ICE's budget went from $2.5 billion to $40 billion, but we don't have money for pediatric brain cancer research. You know, President Joe Biden always said, show me your budget and I'll show you your values. If the value of this country is we'd rather give $40 billion to ICE than find a cure for brain cancer for children, then I don't recognize the country that I deeply love and that I am proud to be an American. Under this administration, it's becoming unrecognizable.